now to the ongoing battle over women's reproductive rights. It was 1 year ago this week the Supreme Court overturned Roe v. Wade, and Mississippi was at the center of the debate. In our series, After Roe, CBS's Caitlin Huey-Burns returned to the state to see how it has responded since abortion became illegal.
These are the diapers that we give out for the families.
The Diaper Bank of the Delta services nearly 300 families in one of the poorest regions of the country and has seen an increase in donations and demand.
A lot of families have signed up for more diapers. If they come in with any type of situation, we try to find a resource to help them.
So people are coming to you not just for diapers and supplies.
A helping hand and a best friend.
A helping hand in a state that needs it now more than ever. Mississippi already had the highest rate of infant mortality nationwide, and the maternal death rate is worsening, especially for Black mothers. It's what a public health expert was warning about when we visited last year, as the state's only abortion clinic prepared to close.
Is the state prepared for the consequences?
No, it's not prepared.
In April, Republican Governor Tate Reeves signed a series of bills he says create a culture of life, including tax credits for adoption and expansion of Medicaid coverage for up to 1 year postpartum. But critics say the bills aren't keeping up with the challenges. In the last year, the only NICU unit in the Delta closed. At least 3 other labor and delivery units across the state have shuttered.
Obstetrics is a lot of times, the first to go.
That environment inspired Dr. Rachel Morris to launch a program called STORK at the University of Mississippi Medical Center, training emergency workers to deliver babies.
They may not have the luxury of getting in a car and driving 2.5 hours. It's got to be so scary for these patients.
So you're able to step in and address a very specific need?
Yes, a very specific need. Again, a rural emergency room that does not have supplies for delivery. If they participate in STORK, it's a way to bridge the gap to give people what they need.
You're saving lives.
That's why I went into medicine, was to make a difference. So to hear that we've saved one mother or saved one newborn or made the outcome better, there's nothing like it.
Morris says the program has trained over 400 people and has a 6-month-long waiting list. Caitlin Huey-Burns, CBS News, Jackson, Mississippi.